So for the routes of medication, we have the oral, via mouth, sublingual, that is taken or below the tongue. No? Sublingual, those are medications given or applied under the tongue. Nitroglycerin, sublingual yan. Buccal, by means of the oral cavity. No? Then we have the epidural or intrathecal. That means it is direct, no, into the cerebrospinal fluid or into the brain. Intraosseous, these medications is given or introduced directly into the brain. We have also intraperitoneal via the abdomen. Most commonly used intraperitoneal drugs are chemotherapeutic drugs. So, chemotherapeutic drugs, these are drugs for use in the management of cancer patient. Intrapleural, that means this drug is inserted into the pleural cavity. So this is the spaces in between the lungs. We have the intraarterial. This drug is inserted directly into the artery. Example of these drugs are anticoagulant or drugs that you need to dissolve a certain clot, no? Or para mawawala yung pamumuo ng dugo inside the blood vessels. Inhalation, so these are drugs given through nasal cavity, inhalant, a drug for asthma, or giving of oxygen, no? Inhalation. The parenteral, given IV, intradermal. Subcutaneous level, we have the IM, intramuscular, and the IV or intravenous. Topical, these are drugs applied directly to the skin. These are example of the drugs. Fentanyl, we have the nitro. Intraocular, these are drugs that is applied through the eyes. You have the application or giving of inhalation medication for patient with asthma. Okay. Now the oral route of medication. So oral route is the easiest and most desirable route. But sometimes food may decrease the therapeutic effect of the drug. No? That's why most of the drug that is taken via the mouth, it is highly suggested, or most of the doctor prefer to take this on an empty stomach, for the main reason that presence of food in the stomach or in the GI tract decreases the absorption of the drug. Although there are drugs that should be taken with the presence of food in the stomach because this drug causes gastric irritation. But it's very important for us nurses to assess the patient's ability to swallow. So if the patient loses this ability to swallow, then any other route can be suggested to the doctor. So this is a presentation on the difference between administration of the drugs via sublingual and buccal. Okay, so it's under the tongue. If sublingual, it is buccal inside the mouth. There are also drugs that is usually administered via the NGT, no? Or we call that nasogastric tube. So if the patient loses the ability to swallow, then the doctor may resort to administration of the drugs via NGT. No? So there are already prepared medications given through NGT, or they have the so-called liquid form, or sometimes the doctor suggests that you have to dissolve a certain tablet or medication in 15 to 30 ml of warm water and administer that through the tube. No? So the step for administration of nasogastric tube medication will be further discussed during your skills laboratory when it comes to care of the patient with nasogastric tube. Nasal instillation, so this is another route of medication giving to the patient through the nasal cavity or through the nose. So the patient can administer this by its own, but after giving the medication, check for some irritation because there are medications that can cause severe irritation of the nasal cavity. And sometimes bleeding might occur, so nasal packing is there, no, for bleeding. And certain surgeries may be used as applied or as suggested by the physician. So for topical administration of the drugs, no, these drugs can be given through instillation in the ears or in the eyes, and topical drugs can also be applied through the skin. No? For eye instillation, so you have to avoid instilling the medication directly into the cornea, no? But also avoid eyelids with droppers or avoid touching the eyelid with the dropper of the medication because it increases the risk of infection. So if you're giving eye installation drugs, you have to administer it only on the affected eye. So never allowed to use a patient or to use another patient's eye medication. So you can instruct the patient, and most importantly, you have to avoid touching the part of the eye and apply that in the lower eyelid. So lower eyelid, not on the center. As you can see on the picture, do not instill drops into the center of the picture, into the black part of the eye, to the pupil. Instead, you have to lower down the eyelid and put a certain or one drop, no? Or depends on the doctor's order. So to avoid irritation of the eyes. Another form of topical medication is administered through ear installation or instillation rather. So in administering the drug through ears, we have to take note that there are structures, no, in the middle ear that are very sensitive to temperature. That's why you have to take note that the solutions you are using are sterile and be very particular to the eardrum since damage to this part of the ear can eventually cause deafness. Also, you need not to force the medication into an occluded canal of the ear, and you have to take note also that during the administration of this drug, you have two things to remember, one for the adult and for the children. So the cut-off age is 4 years old. So that means if you are giving a medication to a child less than 4 years old, you have to pull the pinna, no, or the upper part of the area, no, the pinna downward and backward for children 4 years old and below. But if it is 5 years old and above, then you have to pull the pinna upward, backward. Okay? So those are just the things that I want you to remember in giving medication through the ear canal. Another topical form of administration of the drug is given through the skin. So applied it sterile or use sterile technique using gloves and applicators. So there are many kinds of medications that are administered through the skin. You have there the ointment. Ointment is most commonly used for skin irritations. No? There is also, or there are also burn ointment applied directly to the skin in cases of patient with burns. So there are three types of burns. It can be first, second, or third degree burns, depending on the degree of damage to the skin. So regardless of what type of degree is that, make sure that you use the sterile technique and the proper use of application of topical medications based on manufacturer's instruction. Transdermal patch, now this is also topical type of medication. So transdermal patch is given or applied directly to the skin if the patient has skin disorders. No? Commonly used transdermal patch of medication is used for management of burns. So transdermal patch can be applied by removing the old one and applying the new one. So document the location, what is the response of the patient, or you have to assess the site wherein you're going to apply this patch. Then document that and ask for patient's response. Gumagaling ba siya or ano bang nararamdaman niya before and after applying the patch. And watch out for any complications, especially if the patient complains of skin irritation at the area wherein you're applying this medication. So, topical medications can also be given through vaginal instillation. There are the so-called vaginal cream, vaginal foams, and this is applied directly into the vagina through the use of gloves, or the patient can do this or administers by himself or by herself. Then you need to patch or to collect any drainage. So administration of this vaginal antibiotics or medication is needed also prior to collection of any drainage. This is for further assessment if the patient has any reproductive infections or disease. Topical medications can also be given through rectal instillation. So, just like giving intravaginal medication, you have to wear gloves and, of course, most importantly, provide privacy to the patient. So, rectal medications, those are suppositories. No? Example, suppositories. Or these suppositories are given if the patient has experienced some difficulty of passing out stool, or constipated, and also be given if the patient has or prior to administration of enema. No? Enema is the cleansing out of the gastric system or the lower gastric system, usually done prior to surgery. If the medication is administered by inhalation, then they have the so-called aerosol spray, example. So this is also used by patients who have asthma. We also have the PMI, no, or PMDI, pressured metered-dose inhaler. Most commonly, drugs under this PMDI are the bronchodilators. Bronchodilators, these are given to patients with asthma in order for them to not to experience difficulty of breathing. So, although there are some effects or some serious systemic side effects, and this should be reported directly to the physician. So inhalation drugs are most especially given to patients with difficulty of breathing. So these are example of patients showing administering the drugs via inhalation routes. Then we have administering drug through injections. So each injection route differs based on the type of tissue the medication enters. As a medication nurse, before injecting, you have to know the volume of medication to administer, gaano ba karami, gaano ba laki ang dose na kailangan, the characteristics and viscosity of the medication, because this characteristic or viscosity of the drug sometimes may affect the absorption and distribution of the drug. You also have to know the location and anatomical structures underlying the site of injection, kasi there are many routes for injection as far as the muscle is concerned. Then, if a nurse do not administer the injection correctly, this might lead to a negative result, or the therapeutic effect of the drug will be affected. In administering medication through injection, it is very uncomfortable on the part of the patient. So we as healthcare provider, we have to think of some possibilities or interventions that can minimize the patient's discomfort. So what are those suggested action that should be taken by us or by the nurse? First, I have here, you have to, as much as possible, the smallest suitable length of needle gauge, no? Para medyo hindi or para mas komportable, mas lessen ang discomfort that should be felt by the patient. As much as possible, maliit lang na karayom ang gamitin natin. Then, proper injection site, no, is also important. And if permitted, we have the so-called anesthetic spray. No? This can minimize the pain that can be experienced by the patient when we give injection. Another one, me personally, no, I used to divert the attention of the patient, no, talking to him or to her while giving some sort of medication through injection. And you have to done that quickly, no? Insert the needle quickly but smoothly to minimize pulling of the muscle tissues or to minimize the exposure of the patient muscles to the needle itself. Then you have to administer that drug steady, facing the syringe, and as much as possible, inject the medication slowly and easily. May technique kasi dyan kung paano natin ma-minimize ang discomfort. So these are just some of the suggested techniques how are you going to minimize discomfort felt by the patient. Especially if you are giving injection to a child. Alam naman natin pag bata, nako po, grabe ang takot nila dyan makakita lang ng karayom. So take note of that situation. So injectable types of drugs can be given. First is intramuscular. So looking back at your anatomy of the muscular system, so we have so many muscles in the human body. and there are different types of muscles that is being used as part of giving the medication through injection. So why intramuscular? So faster absorption than subcutaneous route. So if you remember the layers of the skin, you have from the uppermost the dermis, the second layer is the epidermis, the third layer is the subcutaneous tissue, and next to that is the muscle. So also watch out or take into consideration that there are many risks upon administering medication through injection. When it comes to the needle, so as a nurse, you are the one to choose the needle, no, that should be used in giving injection. But generally for the adults, if we are going to use or administer this drug around 2 to 5 ml, no, 2 to 5 ml can be absorbed. For older adult, up to 2 ml. For small children, up to 1 ml. And for infant in newborn, up to 0.5 ml. So in excess of that amount, so you need to verify from the doctor if that drug can be given through injection. Kasi the more you drug or the more drug you introduce to the muscles, the more irritation or pain that is felt by the patient. So still on intramuscular injection, so before giving the injection, you have to properly assess what type or what muscle are you going to use in administering the drug. Also, identify properly the landmarks. No, you have to locate that properly, no, in the patient's body. So that's why in this particular injection, you have to be very careful that you choose the right muscles, because administering the drug in the wrong muscles can also lead to possible complications and malabsorption of the drugs. Be aware of potential complications. No? Usually, complications that arise after injection, pain is there, and sometimes after injection there is malabsorption on the injection site, leading to some manifestation of severe pain and redness, at the same time other signs of inflammatory or infection process. No? This can be traced from if the nurse is administering the drug without proper or without using a proper sterile technique. So you have also to assess the needs of the patient. Make sure that a slight tenderness is present. Then after that, of 1 to 2 hours, there should be no pain or no more tenderness that should be felt by the patient. You have to minimize discomfort, and the needle insertion has an angle of 90 degrees. No? Parang very straight yan, 90 degrees. No? If you are familiar with dart, no? Dart. So, ganyan tayo maghawak ng syringe with needle during administration of intramuscular medications. So I have mentioned a while ago that there are many muscles, no, that are used by nurses or as prescribed by the doctor when it comes to administration of intramuscular medications. No? The first muscle that is commonly used is called ventrogluteal muscle. Now, in this illustration, it teaches us where to locate ventrogluteal muscles. Now, so as you can see on illustration A, so you have to put your left hand on that area, then the right or the left thumb should be on the iliac crest, then the one in between the index and the middle finger is your ventrogluteal muscle. So another way of locating your ventrogluteal muscle is you have to just divide the buttocks of the patient. Divide that into four. You draw a cross line on the buttocks. Then the upper outer quadrant. So the upper outer quadrant is your site of injection. So kung nakatayo ka, no, tayo ka tapos mag-drawing ka ng cross line sa buttocks mo, yung pinakamataas na sa outer part. No? Pwede sa kaliwa, pwede sa kanan. So, ang tawag natin doon, so gumawa ka ng 4 quadrants, ang kunin mo, upper outer quadrant. Kasi apat ang magiging quadrant yan pag nag-draw ka ng cross. Whether the upper outer, the lower outer, the inner, the upper inner, and the lower inner quadrant. So, ang kunin natin, upper outer quadrant. That is the ventrogluteal muscle. So, this illustration, again, shows the area of injecting medication intramuscularly using the ventrogluteal muscle. So this presentation shows the actual administration of medication intramuscularly using the vastus lateralis muscle. The third muscle, and I think this is the most widely used, is called the deltoid muscle. No? So you can use the deltoid muscle either left or right because this is the most easiest muscle to locate. No? And most of the time, it is the area or the muscle that is commonly used for intramuscular injection. Now the question is, how are you going to locate the deltoid muscle? Ang landmark natin dito is the acromion process. No? Acromion process, this is the bone, no? That is above your shoulder. No? Just measure 3 to 4 fingers from the acromion process, and after that you have already located the deltoid muscle. So put 3 to 4 finger from the acromion process, and underneath of that is the deltoid muscle. So you can use either left or right deltoid muscle provided that it is not contraindicated to the patient. Okay, next to intramuscular is administration of medication through subcutaneous tissue. So subcutaneous is the third layer of the skin before the muscles. So why does medication is placed in this particular layer of the skin? So the main reason there is absorption is slower, no, compared to IM injections. No, some of the medications that are administered subcutaneously is insulin. No, insulin. If you remember, these are usually given to patients who are diabetic, having a high blood sugar. Then administering medication subcutaneously is highly preferred for this kind of patient. Kasi ang mga diabetic patient, you have to maintain the blood sugar at normal level. So it is very important for them to have a normal, or let's say exact amount of insulin at their blood in order to minimize a sudden rise in blood sugar. Aside from insulin, heparin is also given subcutaneously. Heparin belongs to the category of anticoagulant drugs. So these are patients who have or very prone to develop clotting. So yung mga pasyente na pwedeng magkaroon ng pamumuo na sa kanilang mga blood. So delikado 'yon pag may namuong mga blood sa blood vessels natin. So in order to prevent that clotting, so the patient will be given heparin subcutaneously through injection. You also have to choose the needle length and angle of insertion based on patient's weight and amount of subcutaneous tissue. So most subcutaneously administered drug is given in the abdomen. No? Sa abdominal area kasi nandyan ang maraming subcutaneous tissues. No? So insulin, heparin, dyan yan ina-administered sa abdominal area. With regards to the angle, so if intramuscular administration used the 90 degrees, then the subcutaneous administration use 45-degree angle. So medyo slower angle siya. Kasi if we give it by 90 degrees, then it might reach the muscle, not the subcutaneous tissue.